So good morning, everyone. Good afternoon for those of you joining us not on the West Coast. Before we get into our presentation, we want to acknowledge that the Initiative for Energy Justice is broadcasting this webinar from land taken from the Mashpee Wampanoag, Aquinnah Wampanoag, Nipmuc, and Massachusetts tribal nations. We acknowledge the painful history of genocide and forced removal from this territory, and we honor and respect the many diverse Indigenous peoples still connected to this land from which we gather. We also want to welcome all of the participants out there in cyberspace. I want to acknowledge the many of you who are joining us from extraordinary circumstances, whether that be due to the stress of the pandemic, or because you're in California and face the imminent threat of electricity shutoffs or wildfires. Thank you all so much for taking the time to join us for this webinar concerning California power shutoffs and the deficiencies in data and reporting in connection with the shutoffs. My name is Shalonda Baker. I am a professor of law, public policy, and urban affairs at Northeastern University. I'm also the co-founder and co-director of the Initiative for Energy Justice, a research and technical assistance organization that provides policy and research support to frontline leaders and policymakers concerning energy justice. The project that we're going to share with you today emerged from a research question our team developed this past summer after working with community advocates who were focused on wildfires and power shutoff issues in California. Our team had a very basic goal. We wanted to understand the impact of Pacific Gas and Electric's, PG&E's, power shutoffs on the most vulnerable Californians, medically vulnerable people, which is to say those who rely on medical devices to support vital life functions, and those who live in environmental justice communities, who share a diverse range of characteristics, including low incomes and living in the vicinity of fossil fuel generation or other polluting facilities. We wanted to understand the impact of the shutoff events engaged in by PG&E on those two communities. So the research question was simple, but what we uncovered in the course of our research actually shocked us. Despite our efforts, we could not locate any data reported to the California Public Utilities Commission, from Pacific Gas and Electric, or any other organization which provided a granular level of detail concerning the impact of utility shutoff events. Understanding these community level impacts allow policymakers to craft policies that are responsive to the unique needs of communities. Knowing who is impacted also allows advocates to identify vulnerable community members and create community level solutions to meet their needs. These shutoff events have now become a routine part of the utility strategy to manage fires, and they have a devastating impact on medically vulnerable Californians. They have devastating impacts on community members who cannot afford to replace foods and medicines that spoil without access to power. These harms are now magnified by a global pandemic that has wrought particular havoc in low-income communities and communities of color. So we hope that this webinar offers insight into the data gaps and the analysis that we were hoping to provide, as well as the embodied health and safety issues that emerge from this new and dangerous power shutoff strategy. So we're honored today, our Initiative for Energy Justice is honored to share the stage with a range of advocates and researchers whom I'll introduce one by one and provide some space for brief introductory remarks by each of the folks who will share the stage with us. Following these introductions, we'll move into the presentation concerning the data gaps. And then I see we already have a lively chat going on. We'll end with questions from our panel, as well as audience members. So we want to thank all of you for joining us, for taking time out of your day in this Zoom life that we're all living to be a part of this conversation. So the first speaker I want to welcome to the stage is Mary Rose Taruk, coordinator of the Reclaim Our Power Utility Justice Campaign. And she'll share a little bit about the campaign as well as the issues that they're working with. And I do want to just ensure that she is spotlighted as we move into her presentation. Thank you all. Mary Rose.
Wonderful. Thank you, Shalonda. My name is Mary Rose Taruk, and I'm calling in from a lonely land, Oakland. And I coordinate the exciting Reclaim Our Power Utility Justice Campaign. It is led by the biggest environmental justice groups in Northern California, frontline communities who are impacted by the harms of PG&E. And we are over 75 organizations strong, and we are fighting for our lives. These issues around utility and energy and PG&E are about fighting for our lives and our loved ones. We are fighting so that we don't get burned down by PG&E and their faulty equipment, that those of us on breathing machines don't get our power shut off by PG&E based on private decisions behind closed doors, that we have low-income communities of color who are being choked by dirty power plants, that we are changing those conditions. And so the Reclaim Our Power campaign for utility justice, the heart of what we're trying to do is actually make energy and access to energy a human right. That in these times where we're sheltered in place, when we're going to school and working from our homes, and that electricity is powering our machines to live and to work and to go to school, that energy, even more so, is a human right for us to live. And so when we look at energy as a human right, and then what we have under PG&E that's privately controlled, mostly by Wall Street and their shareholders only interested in making money, that there's a conflict there. And so our campaign is trying to create a path forward where we want our energy system to be publicly to be controlled by frontline communities and workers and by the public, and that a private path to our electricity and our utility system is not the path forward. It's not the best interest of California, and so we're trying to change that. And so the three main goals of the Reclaim Our Power campaign is to stop the billion-dollar bailouts of our monies, our ratepayer monies, our tax dollars, that we don't bail out private corporations like PG&E when they've falsely claimed bankruptcy. That second is that we're democratizing our energy so that we have the ability to say when they're going to do public safety power shutoffs, that the public actually represents themselves in what we need for public safety. And that the third is that we're rebuilding our energy system to meet the needs of communities and not Wall Street shareholders. And that it withstands climate change, as we're seeing now with a horrendous fire season, north and south, that we are partnering with communities to know what they need, and that would be the energy system that is informed in how we move forward. And so it's been great to partner with the Initiative for Energy Justice on our research campaigns to learn what kind of energy system we have and what we need to do to restructure it so that it does meet the needs of our communities. Thank you. Great to be here.
Thank you so much, Mary Rose, for sharing the key aspects of the Reclaim Our Power Utility Justice Campaign. It's such an important part of the California landscape. I'm going to turn the stage over to Patrice Strahan, who has been a member of the Disability Justice Culture Club and is also a part of the Power to Live Coalition. We're delighted to have Patrice join us and share her perspectives as someone who is a part of these particular coalitions. Patrice?
Thank you. Good day, everyone. My name is Patrice. I'm currently one of the core members of Disability Justice Culture Club, which is one of the organizations in Power to Live. DJCC is a disability justice collective led by and centering disabled and neurodivergent QT BIPOC, founded by the late Stacy Park Milburn, located on Chochenyo Ohlone territory in Deep East Oakland, California. Since the end of 2019, DJCC has been a part of Power to Live. Power to Live is a coalition of individuals and organizations, including Senior and Disabled Action, Fat Rose, Creating Freedom Movements, Mask Oakland, Access Centered Movement, Community Ready Corps, and Disability Visibility Project. Our focuses are survival, solidarity, and action. Last fall, during the wildfires and power shutoffs, a few friends, including Stacy from DJCC and Max from Fat Rose, but also numerous other collaborators, got together to create a grassroots mutual aid network that would get resources and support to elders and disabled community members who were negatively impacted by PG&E's deadly negligence. The support that was offered at that time included providing homemade air filters, helping to smoke-proof homes, and trying to help those who may have needed to leave or who needed access to power to live. We participated with Reclaim Our Power in the shutdown of PG&E headquarters that winter and demanded that PG&E give back its shareholder profits, invest in frontline communities, and that PG&E be turned over to the people. PG&E is paying out shareholders, executives, and lobbyists instead of investing in its networks and developing systems that ensure that our communities have access to the power they need to live. Their inadequate responses to the catastrophes they took part in creating proves that they're dangerously incompetent and negligent. In terms of health, elder and disabled community are the most impacted by the carcinogenic wildfire smoke when forests and homes are being destroyed. When entire communities are uprooted and destroyed by fires, it becomes even more unrealistic to ask people to utilize their safety nets and social networks when those are also being lost. And when our community relies on electricity for mobility devices, electricity for breathing equipment, electricity to keep medication refrigerated, and on, then it's so clear that shutting off people's power and offering insufficient and inaccessible solutions to their loss of power literally endangers their lives. And there's no amount of flyers about preparing a go bag that will help when our people cannot just get up and go or may have no place to go. This is why this year DJCC, along with others, will be campaigning for access to accessible vans in order to help with this. Earlier this year, DJCC helped to restart the mutual aid network from last fall, this time in response to COVID. And now that fire season is upon us again, we're working on figuring out how to shift and respond to the smoke and power shutoffs while still continuing to offer services from the COVID response, since we see that the need will continue much longer than we could have anticipated back in March. So we've been acquiring more resources to share and working to create resilience hubs where power, batteries, and generators will be accessible and available. And though we're proud of the ways that we've been able to support our communities, it was never our intention for this to be the primary focus of DJCC in the way it has been, and the fact that it has become as such a focus of ours. It's just yet another indication of the failures of the systems and the need for change. And we need democratized, decentralized, anti-capitalist energy models where there's ownership, stewardship, and leadership from the most impacted.
Thank you so much, Patrice, for sharing the embodied experience of experiencing these power shutoffs. We wanted to center the voices of those in the communities who are working toward change with respect to the energy system as a whole, to move the energy system more in the direction of justice. We also wanted to ensure that we're centering the voices of those who face the most extraordinary impacts of these shutoffs. So we appreciate both Mary Rose and Patrice for being a part of this discussion. So I'm going to turn the stage over to Dr. Gabriela Sandoval, who is the Director of Strategic Initiatives at the Utility Reform Network. She's been working on these issues for a long time, and I'm excited to hear what she has to share. And again, just by way of providing an overview of how we're going to proceed today, we'll have these very brief overviews, and then at the end of our webinar today, we'll have more of a conversation and back and forth among all of the panelists, as well as engage the questions that have come through the chat and the Q&A. And we'll get to all of the questions at the end. So Dr. Sandoval, I'd like to turn it over to you at this stage. Thank you.
Thank you so much, Shalonda and IEJ, for having me. This is such an important intervention. My name is Gabriela Sandoval. I use she, they pronouns. I serve as the Director of Strategic Initiatives with TURN, the Utility Reform Network. And I'm speaking to you from the occupied land of the Tongva people. The Utility Reform Network is California's leading statewide advocate for electric, gas, and phone customers of utility companies regulated by the California Public Utilities Commission. We've been around for 50 years. Well, I haven't, but TURN has. TURN uses legal proceedings at the CPUC, policy advocacy at the state legislature, and grassroots organizing in communities throughout California to promote affordable utility bills, sustainable energy policies, and regulation of the utility industry in the public interest. Alarmed by skyrocketing increases in utility shutoffs throughout California, TURN launched the Power at Home campaign in 2016. This was a campaign to research, educate, organize, and impact policy with the goal of advancing energy justice in California. We look forward to a day when no one in California will be shut off from critical power. At the time, our research showed that 1 out of 4 California residents was struggling to keep the lights on, and that energy insecurity was threatening the health and well-being of millions of utility customers. In 2018, TURN was also shocked to learn that our research showed 1 out of every 10 customers disconnected by the large electric utility companies is never reconnected. And 1 out of 3 natural gas customers disconnected by Southern California Gas is never reconnected. That's a whole lot of people without energy. At TURN, we believe in a California where electricity, broadband, and phone services are treated as basic rights for all people. And we feel this way if it's a shutoff because a customer can't pay, or if it's massive shutoffs for the prevention of wildfires. In June of this year, we had a blockbuster win as part of our Power at Home campaign. We won a 47% reduction in shutoffs due to inability to pay. That was won with a campaign using data to map shutoffs, the organization of a statewide coalition, and the reframing of shutoffs as a public health concern. We mobilized as many local public health departments as we could and public health professionals in California to help us make this impact. And then about 2 years ago, we began to be contacted by those same local public health departments who had come into contact with us previously. And they were asking us, what can we do about these planned outages to prevent wildfires? And it was then that we realized that even the offices of emergency services were woefully unprepared to help people deal with an irresponsible corporation like PG&E. So as part of that data deficiency that we have, I just want to highlight one thing that we are doing. We're working very hard to kind of help fill that gap. Whenever there is a planned outage, there is a process at the PUC where the investor-owned utility, in this case PG&E, for example, has 10 days to submit a report to the California Public Utilities Commission outlining all the reasons why it had to de-energize circuits and shut people off. All of the work that it did in preparation for this planned outage, all of the notification and other protocols it implemented. After that report is submitted 10 days after the planned outage event, people have, organizations, formal parties and proceedings, what have you, the public has 15 days to respond to that report. So a key piece of work that TURN has been engaging in is educating community-based organizations, disability rights organizations, and other organizations that work with our medically vulnerable communities, local public health departments, as well as hospitals and other healthcare providers, so that they can submit their responses to PG&E's and the other investor-owned utilities reports. It's not a straightforward process, so we're really working to educate folks about how they can get involved in these PUC proceedings and build a body of data, because we know there are absolutely significant deficiencies there. So I'll stop there for now.
Thank you so much, Dr. Sandoval. It's such a pleasure to have you on this in this important conversation, and TURN has absolutely been leading the way in pushing for greater transparency, specifically and particularly with respect to utility shutoffs in California. And to that end, we're going to transition into our last presenter for the day, PhD candidate and IEJ researcher, Marissa Sotolongo, someone who I've had the pleasure of working with for the last couple of years. And again, this summer, she and I and the rest of the team were really trying to understand why we could not get our arms around the particular impacts of shutoffs. And Marissa will walk us through a little bit of that process, hitting on some of the points that everyone here has spoken about today. And then we will move into our Q&A section. So we encourage you to begin to populate the Q&A, and we'll moderate the question and answer at the end. I also want to remind everyone, if your colleagues were not able to attend today, we will be posting this webinar online, and the slide deck that we're about to show will also be available online. So Marissa, without any further ado, I'd like to turn over the stage to you.
Hi, everyone. Thank you for joining us today. My name is Marissa Sotolongo. I'll be presenting IEJ's research on the California power shutoffs.
And 1 second, Marissa, I'm sorry to interrupt. I just want to make sure that we also have our interpreter spotlighted. Okay, great. Please proceed.
Sure. So a brief overview of the presentation. I'll begin with an overview of the power shutoffs, including their scope and duration, and some context on why they're happening. I'll discuss how utilities determine that a power shutoff is necessary, as well as what information the utility has to report after a power shutoff. I'll present the preliminary maps we've created of the power shutoffs in 2019 and discuss policy responses to the insecurity created by these power shutoffs. I'll conclude the presentation with a series of data and policy recommendations for the CPUC and utilities based on our research, and we'll have time for questions and comments at the end. So why are these power shutoffs occurring? First, climate change has worsened the effects of droughts, with longer, hotter summers creating drier conditions conducive to wildfires. Second, the increased suppression of wildfire over the past century has built up flammable material to dangerous amounts, and increased development in the wildland-urban interface has meant that more people are susceptible to these wildfires. Third, utilities themselves are causing wildfires when improperly maintained infrastructure is damaged due to high winds, sparking fires that spread quickly over the state. These policies and environmental conditions are leading to larger, lengthier, and more dangerous wildfires. In response to these conditions, utilities have increasingly relied on public safety power shutoffs. The CPUC has authorized utilities to shut off power during high wind conditions. Power shutoffs were widespread in 2019 and continue to be utilized heavily by PG&E and other utilities, even as we gather for this webinar. Power shutoffs are a key portion of PG&E strategic planning. There's no indication that the utility will move away from their use. This slide shows an overview of the October 2019 power shutoffs conducted by PG&E. The blue bars on the left show how many thousands of people were affected by each of the 4 shutoff events, while the orange bars on the right show the maximum length of time a person's power was shut off during these events. The largest and longest lasting power shutoff, beginning October 2016, affected almost 1 million people, some of these people for over 6 days. The CPUC grants utilities the authority to determine, based on a number of internal and external factors, whether a power shutoff is deemed reasonable. This slide shows a few of these internal and external factors. Utilities are required to report the following information to the CPUC and the public after conducting a power shutoff. 1, an explanation of their decision to shut off power and what factors were considered in that decision. Any wind-related damage to infrastructure and the steps taken to restore power after the shutoff. The time, place, duration, and the number of customers affected by the shutoff, including a breakdown of the customers by customer type. This includes the number of medical baseline customers affected. Accounts of notice provided to customers that a power shutoff would take place, and the local community representatives contacted by the utility prior to the shutoff event. A summary of the number and nature of complaints and claims against the utility because of the shutoff. And finally, the address, location, and hours of community assistance locations and what kind of assistance is available at each location. The issue of power shutoffs has generated several policy responses by PG&E and by the CPUC. Utilities invest in small-scale resilience zones, which are microgrids, generally powered by diesel generators that are able to remain energized during a power shutoff. Utilities provide community resource centers, or CRCs, where customers are provided with water, restrooms, and charging stations. Utilities also invest in infrastructure improvements to make the grid more resilient, and so that power shutoffs can be more targeted. One of these methods is sectionalization, where a sectionalization device is installed so that part of the circuit can be de-energized without affecting the rest of the circuit. PG&E has launched 2 battery backup generation programs to provide income qualified customers on the medical baseline program with batteries, hotel vouchers, and stipends for the duration of a power shutoff. These programs include the Portable Battery Program, the PBP, and the Disaster and Disability Access and Resources Program, or the DDARP. It's unclear whether these batteries are being loaned, leased, or given to qualifying customers, and how these programs will be expanded in the future.
And Marissa, if you don't mind holding on one moment, okay?
Yes.
Continue. Go ahead.
Okay. Finally, the CPUC's Self-Generation Incentive Program, or SGIP, provides rebates for residential and non-residential energy storage projects, with funding set aside for customers who experienced power shutoffs in 2019. The maps of the power shutoffs we created use power shutoff data reported to the CPUC and maps of the electric grid provided by PG&E. We compare this shutoff data to several other indicators listed here. One, the Empower dataset from Health and Human Services, which shows the number of people on Medicare in each zip code who rely on electricity-dependent medical equipment. Two, the Cal EnviroScreen data from the California Environmental Protection Agency, which measures pollution and demographic indicators related to environmental justice. And three, data from the SGIP program, broken down by zip code. This map shows the total number of hours each PG&E circuit was shut off in the month of October 2019. Circuits in gray did not experience a power shutoff during this time period, while circuits in yellow, orange, and red experienced power shutoffs of increasingly lengthy times. This map also shows the location of resilient zones, sections of the grid which were converted into microgrids during the power shutoff, and community resource centers. The problem is that PG&E only provides shutoff data at the circuit level. This makes it difficult to understand where affected customers are located because these circuits cross different boundaries of counties and zip codes and census tracts. This map indicates the Cal EnviroScreen Index for each census tract in California, with darker blue areas at a higher risk of environmental injustice according to the pollution and demographic parameters of the index. Because many circuits cross census tract boundaries, and because the total number of customers on a circuit is unknown, it is difficult to run a spatial regression to study the correlation between environmental injustice and power shutoffs. This last map shows the Empower dataset for each zip code in California, with darker pink zip codes containing a higher number of Medicare beneficiaries with electricity-dependent medical devices. The circuit maps show the number of medical baseline customers affected by one of the power shutoffs in 2019. Looking at this map qualitatively, we can see that there are mismatches between the two data sets. Both are incomplete, as the medical baseline program is opt-in, and the Empower dataset does not include customers who use private insurance. Further analysis of the completeness of the medical baseline program would be possible if we had more detailed spatial breakdowns of the power shutoff data. The next two slides contain our data-related recommendations. The CPUC should instruct utilities to release shutoff data in a unit of measurement that is consistent with the Cal EnviroScreen, Empower, and SGIP data sets. This would be zip code, census tract, or census block level to allow for comparative analysis. The CPUC should instruct utilities to provide information on where circuit sectionalization occurred during the October 2019 shutoff events and how the utility made decisions concerning sectionalization. The CPUC should provide zip code and census block level data concerning enrollment by customer type in the ratepayer funded SGIP program. The CPUC should instruct utilities to release zip code and census block level data on where DDARP and PPB resources are being allocated. The CPUC should also commission a study to investigate the coverage provided by the medical baseline program, investigating where the program is under-enrolled and how barriers to access can be lowered. And finally, the CPUC should survey impacted ratepayers after power shutoffs to assess immediate needs and impacts. We also provide policy recommendations for the CPUC and utilities. PG&E should work with medical practitioners, insurance companies, and government officials to auto-enroll and auto-renew membership in the medical baseline program. Due to the COVID-19 pandemic, PG&E has allowed customers to self-certify their eligibility, and applications for the medical baseline program have increased significantly during the pandemic. The battery provision programs should be subject to increased public oversight and transparency by the CPUC, with clear equity benchmarks included in reporting requirements for utilities and their community partners. PG&E should prioritize those with LMI status, low to moderate income status, and medical vulnerability when considering the location and distribution of CRCs. PG&E should also publicize CRC locations in advance of the fire season, and these locations should remain consistent over the years. PG&E should cite resilient zones to prioritize the greatest number of residents they can serve, especially medically vulnerable and LMI residents. PG&E should also power these resilient zones using renewable energy, not diesel generators. Resilient zones should be expanded in number and scope. The CPUC should direct SGIP funding towards medically vulnerable and LMI communities, where the SGIP program can have the greatest positive impact. The recent decision by the CPUC to redirect SGIP funding to income qualified applicants is a step in the right direction. And finally, the CPUC should restructure SGIP to remove the upfront payment requirements for LMI customers. LMI ratepayers often lack the savings to finance the upfront cost of battery storage systems. They are therefore likely to be underrepresented in the SGIP program. That concludes my presentation. Looking forward to any questions or comments you all have. Thank you.
Thank you so much, Marissa, for that excellent presentation and summary of our research for the past several months. So just as we kind of all shuffle back in to the room, I would like to ask our key panelists today to please turn your videos on, and we will get into a Q&A session, both amongst ourselves, as well as there are 5 questions in the chat, and I will begin to moderate that Q&A. But first, let's make sure that we have all of our speakers. Okay, we do have all of our speakers in the room. For those of you in TV land or in Zoom land, if you'd like to figure out how to not see the empty boxes, so the people who aren't showing their screen, you can click the right corner of your of any of the blank screens, and there's an option to hide non-video participants, and that'll just reduce some of the clutter if you're looking on a small screen. And again, that's any of the screens that don't have a speaker or a video. You can just click the 3 buttons on the right corner, drop down, and go to hide non-video participants. Okay, I think with that, we will have reactions from our experts. So Patrice and Mary Rose and Gabriela, I'm wondering if you have any very high level reflections on what you've just heard. And why don't we start with Mary Rose, since you led us off today.
The environmental justice community is who helped Cal EPA establish the Cal EnviroScreen mapping tool, so that we know where environmental justice communities are at. We know the power of mapping so that we can target programs to alleviate burdens, harms on communities. And so it's within the state's ability to do that. And so, you know, eyes on CPUC. So yes, like PG&E is a huge culprit in all of this, but the California Public Utilities Commission is also on the hook for making sure that the public is protected. So they know that other agencies have the ability to use these mapping tools at the data level that is being asked. And so that is certainly a goal there. And I know there's some questions around batteries and diesel. So we know that environmental justice communities bear the burden of these fossil fuel systems. So diesel is not an answer for the future. And so we know that the utilities and PG&E push that because it's cheaper for them, and that is not a path forward. So the equity goals need to have environmental justice goals as well. And I'll pause there for now.
Thank you, Mary Rose, and thank you so much for your work on Cal EnviroScreen as well. Such an important tool that we thought would be such an easy thing to fit into this analysis, but again, we were surprised by what we found. Patrice, I'd love to turn it over to you to reflect on any of the items that you heard about. And then there are quite a few questions for you in the chat as well. But Patrice will first allow you to reflect on the presentation.
I would just say that express appreciation and gratitude for all the labor that went in to the research, and then to also just mention that PAR, like participatory action research, where communities are engaged in researching and like developing the research about their own communities, and it's something that we're gonna start and have a big workshop on it this weekend, because I think that that component of it is impactful for us too. So just like kind of figuring out where we are. So I think that but I would just say that that is it just to express appreciation for the labor.
Thank you, Patrice. And I want to keep you warm because there will be, there are quite a few questions for you waiting in the chat as well. But Dr. Sandoval, why don't we turn to you next?
Yeah, there's so much great information that was shared. I want to just highlight how important those policy recommendations were there at the end. And in particular, I think one of the things about these planned outages has been the massive disconnect between medical baseline customers, so customers who are registered for the medical baseline program, and people who actually need notification in advance. And so, yeah, I'm just excited to connect with folks and dig into those policy recommendations and find a way to really, move the needle on this. I do want to just say briefly that Turn is hosting a training for direct service providers and for community advocates next Wednesday on planned outages and medical baseline. We'll be highlighting how to register for the medical baseline program, who is eligible, and changes that have recently been made to make medical baseline more accessible to customers. So anybody who's interested, my colleague Jorge Rivera just placed the registration link in the chat. It's a free training, so feel free to circulate among your networks as well.
Thank you so much. So much good information here, and there is a lot to dig into. So I want to jump to the chat. We have a hand raised, and we'll get to the hand as well, and we'll allow Melissa to manage that on the tech end. But there are two questions related to resources for disabled people, and one is people keep saying that disabled people who need continuous electrical service need to get generators, and that's the answer. But what do you do if you're a renter? And so that's one question. And what is the role, or what should be the role of landlords in that? And a related question would be, PG&E says it's going to provide hotel vouchers for qualifying disabled people who rely on electrical equipment. How are they being evacuated? How are these folks being evacuated to the hotel? So two really specific questions related to access to generators, as well as getting out of harm's way physically when you've received notice. I'm wondering if anyone on the panel has anything to offer, or Patrice, if you would like to start us off, that would be great.
I would just say that I think both are valid questions. I don't, in terms of like how landlords provide generators or like provide that, or I feel like the reason why we've been using resources to try to purchase generators and like try to set up systems so that people could access them is because folks don't have it. I mean, I feel like it seems like it would make sense for that to be provided, but or like required, but at this time, I think folks are still feeling like that's something that they would need and is not necessarily provided. In terms of PG&E and the hotel vouchers, I'm not familiar with how that system is operating at this time.
Well, thank you, Patrice. I mean, I think that's actually part of the point of this webinar as well. I mean, there's so many gaps in terms of accessing the resources that are so vital to keep people safe during these seemingly random shutoffs. There are a couple questions about the data. I'll go ahead and answer that. We do have a policy brief that is being released today in connection with today's webinar. We are also happy to share any of the resources that serve to put together the policy brief, as well as any of the maps. We relied on publicly available information, so the Health and Human Services Empower data set, which is updated monthly, and Marissa went through that. We also relied on the Cal EnviroScreen data set, which is also publicly available. We did rely on reports that were submitted by PG&E to the California Public Utilities Commission to sort of overlay that circuit level data on top of that more granular EJ data and medical vulnerability data. So we're happy to explain the methodology, but it also is laid out in the policy brief. So Gabriela, I think I'm going to turn it over to you. There are a couple questions about how folks should engage with the PUC, given that there are strict rules regarding ex parte communication, as well as the structuring of the percentage income payment plan. If you could provide an overview of that. I mean, they're related questions because they both relate to the CPUC, and I know TURN grapples with these issues all the time.
Yeah, okay. So let me start by saying that for organizations that don't have a legal team or an attorney who can file reports on their behalf, TURN is definitely serving as a kind of conduit for folks' responses to those planned outage reports. So if anyone is interested, please feel free to reach out to me. I'll put my email address in the chat box. Like I said, we work at different levels with this. We can either work with you to submit your own report, or we can add your report as an addendum to TURN's report. We can do it with or without attribution. So as long as it doesn't contradict anything that we are sharing as a part of TURN, we can, work together to make sure that as many different perspectives and voices and suggestions are submitted to the PUC. So that is definitely something we're doing. It's pretty hard because there is a 15-day turnaround time. And so a lot of organizations just don't have the bandwidth. But, I've been known to just take an email of bullet points and massage it into something really coherent that I can then add to our attorneys' comments on reports. And it's really important because PG&E will say, we contacted this public health department. Well, yeah, they contacted like the reception area and left a message with very little detail, but we need to know that. So that's a really important source of data. The other thing I'll just say quickly is that somebody asked about, and I don't know if this was the question that you mentioned about the percentage of income payment plan, but there was a question about affordable payment plans. And
That's right.
Yeah, because of this is actually a big win. That was part of the disconnections proceeding in June that I mentioned earlier. It used to be that if you were behind on your bills, you called up PG&E or any of the other investor-owned utilities and you said, hey, I'm behind on my bills. I owe, $900. I need a payment plan. They would ask you for $500 up front and then another $200 2 weeks later and another $200 2 weeks after that. And you had to stay current on your new bills on top of that. Well, as of June 11th, the utilities now have to offer 12-month payment plans to everyone across the board, which is huge. And they can't ask for more than 20% down on that debt. And folks should know that until April of 2021, April 16th of 2021, there are consumer protections in place due to COVID. So there are no shutoffs that can be conducted by the investor-owned utilities until after that April date.
Thank you so much, Gabriela. And we know that the idea of shutoffs, or the issue of shutoffs, is a pervasive problem around the country. I want to turn it over to Mary Rose to offer comments as well as closing comments, if you have any, because we are running up against the hour in this exciting conversation.
Yeah, and I know there's more questions out there. I want to say, as Reclaim Our Power, challenging this private monopoly corporation of PG&E controlling things, we question whether these power shutoffs are even necessary. So we know that PG&E was guilty of 84 counts of manslaughter from the fires in Paradise. That they are a criminal corporation, that they are supposed to incorporate more wildfire safety and plans for safety, and they actually are not meeting those plans. And the CPUC is supposed to ensure that if PG&E cannot be safe, that the CPUC has the ability to take back the operating permit of PG&E and turn our utility into Golden State Energy, which would be run by a nonprofit. And so yeah, even questioning whether these power safety these shutoffs are even necessary, and then the differentiation around what we would need to do to cover renters versus homeowners. And what they need in terms of battery or generation that's clean and safe, like all of that should be studied if we do have to do power shutoffs. But even questioning whether power shutoff should happen should be part of the equation, and the CPUC is on the hook for that.
Well, that is a great note to end on. It's clear that we need to have more time for discussion. This was very rich. We'll think about whether or not we want to host a broad webinar to have more of an open discussion with those who are interested. But we appreciate everyone out there for joining us for this hour. It was jam-packed. And please look for our policy brief on the iejusa.org website. Everyone have a fantastic afternoon. Much love to the IEJ team for putting this together. All of our fantastic panelists and interpreters for just really being a wonderful part of our conversation today and community. So thank you, Patrice. Thank you, Mary Rose, Gabriela, Marissa, for continuing to grind on this research. It is stellar. Y'all have a great afternoon, and we'll talk to you next time. Bye-bye. Thank you.
Thank you.